Hi everyone. I recently received a question regarding dry needling, and the question was, is dry needling painful? The answer to the question is that it depends on, one, the school of thought of the practitioner. Some schools of thought require the practitioner to use more pressure and depth than other schools of thought. The other variable that comes into it is the purpose of the dry needling. If dry needling is being done to break up scar tissue, for example, then it inherently will be a little bit painful. However, ultimately, the provider who's doing the dry needling should be able to keep the discomfort level manageable for the patient. In my own methodology, when I do dry needling for myofascial trigger points to release muscle knots, I don't do it in a painful manner. I do it in a slow, controlled manner, and the depth that I'm going to is progress very gradually. Some schools of thought require needling in a style where the needle is pushed through tissue very quickly back and forth, sometimes referred to as pistoning. I do that as well. But all of my dry needling techniques involve a slower progression of depth, and I'm always doing it based on the patient's comfort level. Other practitioners have a different school of thought, so it just depends who you've been trained by. So it does not have to be painful. It just depends who's doing it, how it's being done, and then again, what purpose is it being done for. As I mentioned, if it's being done to break up scar tissue, for example, then regardless of who's doing it, there will be some pain involved due to the nature of the intent. Thank you very much for watching. If you have any further questions, please leave a comment below, or you can email me directly.